Thank you for tuning in this evening. We have tonight with us a biomedical scientist and research engineer, Victer Muhammad, who will be discussing with us this evening the comprehending and arresting the complex mental health pathologies in the new Millennium human. We'd like to thank you for coming on this evening, Brother Victer, and we'd like to thank our viewers for tuning in. My name is Eric Ahad Muhammad with Nature's V. We are here tonight to discuss these issues on mental health because we see so many occurrences of mental health in our community over our lifetimes and directly affecting our lives daily. And it was the passion of Mr. Victer Muhammad to discuss the pathologies that are occurring that have caused these mental health issues. So first of all, I'd like to say thank you, Victer, for coming on this evening. And can you give the people your background as it relates to the mental health side of your background?
Yes. First of all, I have grown up in America for the last 55 years of my life. I was born on a plantation in the Mississippi Delta in a little town called Morgan City, Mississippi. And the first 10 years of my life were spent on a plantation. And that started me on the road to having to deal with mental health and mental illness. You don't get to live on a plantation without suffering from mental illness and having mental health problems. Then in 1990, I started to study Islam. And Islam has a reformative property for the African American if it is properly taught and properly understood. And the recipient of the edicts of Islam, if properly applied in their lives, Islam does have a reformative property. Then in 1993, after spending 3 years in the prison systems teaching manhood training and civilization to the inmates in Washington, D.C., Maryland, Northern Virginia, Pennsylvania, and some of the Carolinas, I started to teach these reformative properties in St. Elizabeth Mental Hospital, Pittle, in Southeast Washington, D.C. And this was my first introduction to what is called forensic mental health, forensic recovery. And I did that, and I was able to be effective in helping the men to teach them in their process. And many of them were released from St. Elizabeth after talking with them and meeting with them. And then I've had about 32 years of work dealing with mental illness in one form or another. And I was the recovery specialist at an outpatient mental health institution in Florida, where I became very effective in helping the people to recover, to first of all, to isolate their problems and then to begin a recovery process from their problems to the point where the COO and the human office, because they wanted to know what was I doing that was causing so many people to recover from their mental illness. And I would not tell them because I had learned this on my own. This is basically a very brief summation of my experience in mental health. There's much more to it than that, but we have a limited amount of time to discuss this evening, and we will be giving people contact information so that they can contact us to get more information on how they can receive the services that we provide. So they will have an opportunity to get more information, and we will be doing seminars and lectures at our facility, because this would be the better place for you to get more detailed information than this introductory process that we're doing this evening.
Thank you for that introduction, Mr. Victer Muhammad. I want to go right into our questions for this evening because our time is limited. My first question is, what people would you characterize as having the most mental health issues today?
If I were to select a people from the members of the human family, and you consider the atrocities and the pathologies that have affected them for the longest period of time, I would say that the so-called African American is the population on the earth today who suffers from the most mental illness and mental health problems. I would say it's the African American. And African American is defined by anyone who is a descendant of slaves. So the brother or the sister who arrived here 100 years ago from Jamaica or from Nigeria or Ghana, those are our brothers and those are our sisters, but they are not descendants of slaves. And so they have not suffered the mental destruction that the African American has suffered.
Would you like to describe to us some of what you found as it relates to the mental destruction of the African American, or would you like to go into further into the question?
I would, when you consider the social norms of the African American, what I intend by social norms is things that we do every day and we see nothing wrong with it. Number one, probably, I'm guessing now, an estimate, but maybe as much as 90% of African Americans today, more than 130 years after the so-called end of slavery, I would say 90% of African Americans still carry another man's name. And this is indicative of something. Also, when you consider the divorce rate of all the people of the earth. Now, the last time I checked was about 2 or 3 years ago. But the African American had surpassed Switzerland for having the highest divorce rate on the earth, the African American. And how can you have a sane population when 82% of your marriages end in divorce? What are the pathological problems that come in the mind of the husband? Are there pathological problems that occur in the mind of the wife after a divorce? Are there pathological effects on the children? You see, and I would venture to say that the answer to each of those questions is yes. And so we'll stop at those two because, again, we want to encourage people to discussions that we will be doing and contact us for further information.
Yes, sir. Thank you very much. How would you characterize the mental health issues in the world today?
Well, I have had the honor and the privilege, and I'm grateful for having this honor and privilege of traveling to approximately 37 countries on this earth. And I'm grateful for that, because if I were not able to do that, I would not be growing into the man into whom I'm growing, exposing and his psyche. And as I have traveled around this world, spending 14 years in Washington, D.C., and Washington, D.C. today is what Egypt was a few hundred years ago. Washington, D.C. is a microcosm of the greater microcosm known as the earth. Every person on the earth can be found in Washington, D.C. And because I was a researcher, a scientist, the institutions where I worked housed people from all over the world. And so as I travel around the world and compile my experiences with people in social settings, in the airports around the world, on 14-hour flights and 19-hour flights, and putting on khakis, a golf shirt, and some sandals and walking down the street, blending in with the population, I have found that no matter where you go, you're going to find mental illness. And I would say that the entire earth is in need of mental health recovery. And there is a pathology for that. And what is pathology? Pathology is the cause of a disease, and mental illness is a disease. And so there is a cause for all of the mental illness that we find on the earth. And that most of that mental illness can be traced back to one source. We won't go into that source now. We'll do that later. But I would say that the earth itself is suffering from mental illness.
Thank you, Brother Victor. Do you believe the conventional mental health practices are effective today?
The conventional mental health practices, they do have some efficacy. And whenever you speak, you must try as best you can to be factual and always be balanced, whether you like something or not. When you consider the mental health philosophies and theorems that are being practiced today, these are the same philosophies, theorems, practices that the European, when he went to the banks of the Nile during the Renaissance period, and perhaps just before and after the Renaissance period of Europe took place, they would leave Europe, the Netherlands, Holland, England, Germany, Spain, Portugal, France, and traveled down to the banks of the Nile, where at that time it was the seat of all knowledge on the earth. And they studied under our fathers, and our fathers taught them psychology and mental health, medicine, jurisprudence, law, philosophy, architecture, religion, and so forth and so on. And the mental health and psychology that people like Dr. Freud were taught may have been applicable during that time. But as if you are 50 years old today, you can remember in 1970, Ford made a car called the Galaxy 500. And, you know, people thought that it was the greatest thing since they put the Kool-Aid spigot on a refrigerator. But, you know, if you compare the Ford Galaxy 500 from 1974 to the Ford Thunderbird or the Ford, whatever Ford makes today, I don't know what Ford makes, but you would see a gulf of a difference in the engineering that went in on that Ford Galaxy 500 in 1974 and a Ford today, a 2020 Ford. Because the engineering that Ford applied in 1974 has increased and has grown, has expanded since 1974. And so if an engineer from 2020 were taken back in time and had to operate in 1974, he would not be successful. And so for us to be applying the theorems of Freud today in 2020, when you did not have mass killing, have a divorce rate that rages across the earth today. Even in countries where traditionally there was almost no divorce, but you go there today and these countries are suffering from divorce. You have now where men are being reported to sleeping with their own daughters, brothers with sisters and vice versa. You have all kinds of social problems. In those days, at least in the public, women covered themselves. But that's not today. Even in the Muslim countries today, you find women dressing provocatively now. So no, I would have to say that the theorems and the philosophies that came about during the European Renaissance period, which is the same philosophies that America borrowed from when America was established just over 200 years ago. And they're still using those philosophies, and they wonder why it's not effective. And it will never be effective. Never. Because it's outdated.
Thank you, Victor. I have a question from one of our hosts who's normally on, Dr. Patrice, but she sent a question in and she said, where would the Black man and woman start to heal our communities of mental illness today?
Repeat the question.
Where would the Black man and woman start to heal our communities of mental health today?
The recovery process has to be systematic, and it has to be germane to the problems of the Black community. when you study going back 100 years, when people from the so-called Middle East would come to America and see the condition that they found us in during those times, many of them tried to help us, and they were sincere in their attempt. They taught us Islam, and they did the best that they could to help to reform us. But if we are to be honest, they were ineffective. And the reason that they were ineffective is because their approach was not, it did not have the specificity required to bring us out of the condition that we were found. And when you have a human who has systematically, for more than 300 years of quote unquote chattel slavery, where we were turned into animals, because anytime you withhold the sciences of civility from a human being, then you reduce that human being into an animal, because that's one of the main and only factors that separate the human animal from the so-called lower animals. Because if you were to take a course in genetics, you would find that this world reports that the chimpanzee, the orangutan, shares 99% of the same genetics of the human being. I don't know if I agree with that, but I won't tackle that subject here. But it's close enough to make a point. And so the black man and black woman in America has to have his and her issues addressed with specificity, meaning that the problems from which the African Americans suffer is different from the problems suffered by any other human being living on the earth today. So if you take the psychology that's used in China, the psychology used in England, the psychology used in Kenya, in Jamaica, in Venezuela, it would not be effective in helping the African American, because the problems from which the African American suffers is different from the problems of every other human being. So these are the kinds of contentions that have to be taken into consideration if you're going to devise a program to reform the African American. And that has to be done through the leadership. So when you have your preachers, well, your clergymen, your religious leaders, I should say, your education, your people in education, and your people in politics, these are the three classes of human beings that lord over the people. And in no other population is that more prevalent and effective than in the African American. But the problem is that those are the three populations that, if we are to be honest, and if we're going to improve our condition, we have to be honest, then we would have to agree that these are the three populations. These are the three groups: the politicians, the educators, and the religious leaders, who primarily are keeping the African American in the condition that he's in today.
Thank you. We have a question from one of our viewers, Miss McNeese. She wanted to know, how do we address trauma-induced psychosis, specifically trauma created from environmental or nurtured-related causes?
That's a good question. And it's very simple and easy to treat that. The first thing that you would have to do is locate the pathology. And one of the faults of Western medicine is that everything is treated with the box approach, the cookie cutter approach. And that is ineffective because no two circumstances and no two situations are identical. And so, though there may be similarities, they're not identical. And so, to give the listener a succinct response, that would be that you would have to address them on a case-by-case situation approach, a case-by-case approach. That means that that person would have to come in and have a consultation, and then the recovery process would be formulated based upon that particular person's situation. It doesn't always require medication and drugs. Sometimes that's necessary. But in my work, generally it's not necessary.
I'm going back to our questions. Is there a need for an innovative mental health reform?
Yes, without question. The reason I said yes with emphasis, it goes back to the discussion we had a few minutes ago about the philosophies that undergird Western mental health. It began with people like Freud.
Right.
And we've already discussed that it's ineffective today.
Right.
It does have some efficacy, and we won't deny that. But when you consider the number of people walking the streets every day in America suffering from mental illness, then how effective can it be? And so if it has proven itself to be ineffective, no reasonable person can successfully argue with mathematics. No reasonable person can. And if we cannot argue with mathematics, and we can't, the numbers just say that Western mental health practices are outdated. And if they are outdated, then that means that we have to develop practices and techniques today that are innovative, meaning they're new. They are in time, they are in sync with current time. They are in sync with the pathologies and the problems that people are dealing with today. We are today, we have to have the 2020 Infiniti Q50. We have to have the BMW. We have to have the Range Rover. We have to have the jet ski, the treadmill that sits in the bedroom on which you hang your clothes, and the motorcycle. The husband has to have the Ducati motorcycle that he never rides because he's always at work. And so these require an insurmountable amount of income. So now the philosophy, at least in America, is, oh, you have to have two incomes today to live. Well, I don't agree with that. I don't agree with that. If you make certain decisions you have to have two incomes. But so now we are dropping off our children at daycare centers, the babysitter, and wherever else we do. And the babies are being given bottles that contain cold milk. And part of the development of the human psyche is placing a baby on the breast of the mother and the baby tugging on the breast. And that helps in the development of the baby's brain. So today we have a society in America of people who are very cold and insensitive people. And we don't know from where that came. Well, a great deal of it probably came from the fact that that child that's cold today was given cold milk as a baby. And there was virtually almost no contact between the baby and the mother. And so the baby doesn't have a connection to anything, you know. And so today, we're suffering today in America because we are in 2020, the year 2020, but we're still using the psychological approaches and the mental health methodologies that are at least 1,000 years old. And I think that we can all agree that time has changed considerably over the last 1,000 years. And so our mental health strategies in what we use to combat mental illness has to also change. And this is why innovative techniques are necessary today.
One of our viewers asked a question: why do you think mental health is not covered by health insurance?
I don't know if that's categorically true. Mental health is covered by health insurance. Maybe there are some health insurers that don't cover mental health. And maybe there are some issues that might not be covered by some mental health insurers. But I'm pretty sure that mental health is covered by insurance. So I don't know how to respond to that other than what I just said.
Okay, thank you. Another question is, did the advent of slavery serve as a pathology for the present day mental illness in the African American? And I know you covered that, but this is a specific question right now.
Oh, no doubt. If we study history as it is taught in America, we are given the perception, the illusion that the slave was picked up on the continent of what is now called Africa, brought between 9,000 and 6,000 miles to the shores of Jamaica, Haiti, Brazil, and then all of a sudden we were hit one time with the whip, and this is how a slave was made. And that is the furthest thing from the truth. In order to make a slave, you must first disconnect the human being from the source of all civility and the source of all humanity. If you want to stop the light from illuminating from a lamp, you must first disconnect the power cord from the wall outlet. That stops the current from flowing to the bulb. And so what the Caucasian did during slavery was that he effectively disconnected the black man and woman who had been brought here on the ships from the source of their light. And that light is today God, and that light 464 years ago was God. And so the black man and woman who was brought here was prevented from studying Islam. If you would go to the Library of Congress in Washington, D.C., the actual notes of John Hawkins are in the Library of Congress. They haven't been transcribed. They are there on display. Well, they were years ago when I lived in Washington, D.C. And you can go there and read his actual notes. And he wrote in his notes the number or the percentage of the slaves who were Muslim. And you cannot enslave a Muslim. It is an impossibility because a Muslim will never stop fighting. And if you go and read the notes of the slave traders and read the notes of the plantation owners, you can't go by the history books. You have to actually read the accounts going back to the plantation. They recorded the number of uprisings that took place on the plantations all over the world. And it was always the Muslim slaves who were the ones forging the uprising, because you cannot enslave a Muslim. He will die before he allows himself to be a slave. And so today we have a history book and history books that attempt to convince us that all you had to do was threaten to hit us with a whip,
right,
and that caused us to be slaves. No, there was a dehumanization process that turned us into the slaves that we are, that we were, and many of us still today. If you go to the Library of Congress again, and you look in the congressional notes from 1922, where Congress was discussing whether or not to allocate funding to build Howard University in Washington, D.C. And in the congressional record are the words of the senator or congressman from West Virginia. And he said to the other congressmen, why should we set aside funds to educate the Negro when we will never teach him the science of mating, the science of business, and the science of warfare? Now, an alert person, a civilized person, would ask the question, why would you not teach the Negro the science of mating, the science of business, and the science of warfare? Why these three sciences are you going to withhold from the Negro? Well, any civilized person knows that these are the fundamental three sciences out of the sciences of civility that creates a civilized human being, and it creates a self-determined human being. And was the senator, congressman correct? Let's ask the question. In order to have a successful marriage, one needs to know the science of mating. You don't just get a wife or a husband based on physical characteristics, because if you do, you'll have the highest divorce rate in the world. And so if we consider them withholding the science of mating from the African American, or as he put it, the Negro, then we do currently, well, the last time I checked, the African American has the highest divorce rate of all of the people of the earth. So maybe the senator or congressman knew what he was talking about. Okay, let's consider business. Do we know the science of business? No, we don't. You may say, well, I got this business, excuse me, where I sell this and, well, that's for another discussion. But no, that's not the science of business. And do we know and have we been taught? Well, how do you know, Victor Muhammad? Because a person can do almost anything they want to the African American community, and there are no repercussions. Our women get raped, nothing happens. Our daughters are raped, nothing happens. In Florida, I saw where a sheriff's deputy beat a black woman with his fist, a grandmother. Nothing happened. And so we lack the willingness to defend ourselves and defend our families. And this is indicative of a people who have been made docile and unwilling to go to war to protect what belongs to you.
That leads me to a question that I have, and from the issue of mental health and the pathology behind it. After 465 years of the treatment that we've gotten, and we haven't built a society for ourselves to teach our children our languages, our culture, our type of education. How would you view our reluctantness to want to separate and create an environment of your own? Would you categorize that as a mental health issue?
Oh, it's one of the symptoms of a mental illness. Everything that you see that is characterized as mental illness is not necessarily a mental illness itself, but it is a symptom of a mental illness. The refusal to take your own destiny in your hands is a sign to the rest of the civilized world that something is wrong with these people. If you don't believe it, sometimes if you travel abroad, because the average African American goes to Jamaica and the Bahamas.
Right.
But if you travel other than these places, when you are going through immigration in the airport and you hand the person, the immigration officer, your passport, sometimes watch the expression on their faces when they open your passport and see your name. You see. And even after 464 years of being in America, they still don't realize that we are still walking around with the names of another man as our surname. And people will look at you and they'll look at me. They won't say anything because they're refined and they're dignified. But they're asking themselves because they've asked me about this. And I have to politely explain it to them without coming across as putting down my own people. But I have to be truthful at the same time. Because one of the problems from which the African American suffers is denial. And this is one of the reasons we don't seek help, because we're in denial. And until we are willing to acknowledge that something's wrong, then there is no chance of helping us. And one of the things that I always tell people who want to get involved with healing people, look, you have to wait until they let you know they're ready for a change. Otherwise, it's an exercise in futility. It's like trying to get a woman away from a husband or an abusive boyfriend. But she's not going to go anywhere until she's had enough. And that's just the human psyche.
Well, we have a few minutes left, and first of all, again, I'd like to thank you, Mr. Victer Muhammad, for coming on and discussing the pathologies surrounding mental health. And I want to give you some time to give our viewers information to contact you, and not only that, let them know how we can go forward collectively as a people and begin to address this issue of mental health in the communities through your office or through other institutions or organizations that you would suggest.
Well, I will not refer people to anyone other than myself or those with me. Because if I do that, then I'm telling the people that I condone, I agree with, I reference another person. And I'm not going to do that, because that makes me responsible if you go somewhere and you're not properly treated. And, and so I won't do that. Now, you can reach me via email at lifesciences with an S 2001 at hotmail.com. I'll spell it LIFESCIENCES 2001 at hotmail.com. That is the best way to contact me. Or you can go to one of our partner websites. That is Natures V, NATURES-V.com. And there is a contact form there where you can fill in this contact form and you can request a consultation. If you go to Natures V website, you can see all of this, and you can contact us that way. Also, we have a healthcare system that we are promoting. We have not, doesn't mean that we're not in business to help people. And so if you go to either of those sources, you can find us and you can contact us. Another one of our partners who you can contact is Dr. Patrice Muhammad's business, and that is healthatitsbest.com. Healthatitsbest.com. And that's located in Chicago, Illinois on Stony Island Boulevard, I think. And you can contact Dr. Patrice.
I was just saying Stony Island Avenue.
Okay, Stony Island Avenue. Thank you.
And it's healthatitsbest.net, sir. Sorry.
No problem. Thank you, Dr. Patrice. Sorry. So these are some of the ways that you can contact us. And we stand behind the practices that we have and that we employ, and we not use medication because we find that most mental problems can be repaired without the advent of medicine. And so we don't use it. Now, you asked me another question, Mr. Ahad. What was it?
I think you covered it. I asked you to give them where they can contact you, and also who you would recommend, and you told them that. But we do have another question from one of our listeners, if there is time, and we have 5 minutes. And the question is, being that our youth are less than convinced that the current marijuana products have a direct correlation to many of their mental health related issues, what suggestions can you give us more concrete evidence to guide our youth as it relates to the mental health issues that they're suffering from the use of marijuana?
Well, let me respond like this, because that's a good question, and I'm glad the viewer raised that question, or the listener. I have spent at least 37 years of my life as a biomedical research scientist and an agricultural research scientist. In that time, I learned the practice of mathematics and studying facts, FACTS. To date, I have not seen any research conducted by a scientist that has demonstrated that marijuana, or the smoking of marijuana, has a deleterious effect on the mental stability of a human being. Now, when I was in college, I was a musician. And because of the turbulent life of a musician, being on the road, traveling, being on buses for 14, 18 hours, eating in cafeterias and restaurants and getting back, that was a tumultuous life. So during those years, I used to smoke marijuana and I used to drink. And I remember the effect of marijuana on me, but it was always temporary. So I have a firsthand experience using marijuana. I haven't used it since 1988, but I did used to use it. And I haven't seen any data from a study done by a scientist. And I really only give credence to reports that have been performed by a scientist. And so most of the time when a person is telling me about this product that they use and it has all these benefits, and that product that they use and their cousin uses this, and, I don't comment. But since you ask me, I will respond this way. I haven't seen any data that deleterious effects on the human psyche. So until that time, until someone can send me a study done by a scientist, then I can't comment on it.
Thank you very much for that answer, Mr. Victer Muhammad. We'd like to thank our viewers for tuning in tonight to Life Sciences How to Eat to Live on Facebook Live. We will be coming back next week with another presentation. Please share this presentation with everyone. Again, thank you, all your listeners, for tuning in, and God willing, we will see you next week. We leave you with the greetings of peace. Have a good evening. Thank you.